I think I might have spent absolutely no time thinking of whether or not I would have ever ended up in this field if I wasn't in recovery. So, and you just made me think of that. Like I can't even imagine. So, one way it impacts me is that there's no way I would be doing this if, or who knows, maybe I would have become some kind of therapist. I don't know. But the way it impacts me, I think, is there's a positive side to the fact that I've gone through a lot of the experiences. There could also be a negative side that could lead me to sort of projecting my own experience onto somebody else. But because I kind of realized that a long time ago and have had a number of different mentors beat that out of me, of course I'm sure I could slip into it. I always have to track myself, but I think that I've become pretty good at utilizing the fact that I've been there on the client's behalf. So I think that's, without it being, sponsorship in Alcoholics Anonymous or something like that. It's a clinical relationship where, because I have that experience and because I've had that recovery and I've had that exposure to and worked with all these different wellness modalities, I feel like I won't say that it puts me at an advantage over those who haven't. I'll say that it definitely feeds my perspective. It helps me to better understand what it is a person's going through and maybe what might heal them. I'm very careful to not think, oh, they're going through this, and when I went through this is what I did. I think my clinical training helped me to see how that's not clinical. So it has a huge impact. And the last thing I'll say about that is that I'm also very careful not to think of my clinical work as my recovery. My recovery is my recovery. I have to be, especially, I remember when I went, before I did my doctorate, I did my master's, I feel like the first semester, the whole semester was, the only thing I learned, and because it was like thrown at me from every different direction, was you're going to have to take care of yourself in this profession. That was it. That was the whole semester. So I'm really aware that I need to be very vigilant about my own recovery, working in recovery, and working as a clinician in recovery.